Well, good morning, everyone. It's a pleasure to be here and to share some of our clinical data. I'm responsible for the medical retina section at St. Eric. It's a quite large section with 12 doctors doing medical retina. And today I'll share some of the data about our treatment with anti-VEGF, Lucentis, in patients with diabetic macular edema, a 2-year follow-up. I don't know how many of you that work with diabetes, but I will do a very, very short introduction. 85 to 90% of all diabetes is type 2, that is adult onset diabetes. And the prevalence of diabetes varies a lot over the world. And the prevalence of type 2 diabetes is increasing, as I'm sure you all know. And in Sweden, we have a rather recent study from a city called Linköping that could be representative for our country. The prevalence that in Sweden, that means that about 5% of the Swedish population have diabetes. Diabetes retinopathy is the main eye complication of diabetes, and it's the leading cause of blindness in working age people in the Western world. And the incidence of diabetic retinopathy increases with disease duration, and after 20 years, the majority of patients have some kind of retinopathy. Briefly, we classify this into retinopathy with newly formed vessels and bleedings, and then what we will be discussing today, maculopathy with swelling in the macula and exudations. The prevalence in Sweden of maculopathy in all diabetes is 2.5%, and it's a little bit more common in type 2 diabetic patients. The treatment we have been using is Lucentis in this case. I don't know if you use Lucentis or Avastin here. And as you know, it stabilizes small vessels, reduces leakage, reduces macular edema, like in this UCT example. I will just short remind you of the Novartis Restore study. It's good to have to compare with our own data later. In this study, there were 3 arms, one where the patients got Lucentis, one where they got Lucentis together with laser, and one arm where they got laser. And that was during the first year. In the second year, the label was broken, and everyone from here could get treatment with Lucentis up to 3 years. So what happened in this study? Well, as I'm sure you all remember, the patients with Lucentis or Lucentis and laser together had a rapid improvement in visual acuity and were stabilized up here to 1 year. The ones that got laser also gained some letters, but not at all as much as the injection-treated patients. And then as the study continued, here everyone can get injections, and you see that also the laser group starts to improve. And over here, by 3 years, actually there were no difference between these 3 groups. But you can see that these groups, they sustain their visual acuity over a 3-year period. And how many injections did they get? Well, the first year, of course, laser, no injections, but 7.5 injections the first year, and the second year around 4 injections. When Lucentis was approved for diabetic macular edema in Sweden, at St. Eric we decided that we wanted to see how do these patients do in our hands, in our own clinical settings. So we followed these patients more carefully, like in a study. And we looked at their visual acuity outcome with ETDRS visual acuity, looked at anatomical outcome with OCT. We wanted to see how many injections they needed. The patients that were included have to have the foveal involvement of the edema, visual acuity between Snellen 0.1 to 0.63, that is 34 to 73 ETDR letters, and the thickness of the macula with our series OCT. They were not allowed to enter this study if they have had any previous injections, if they have had, if they were active proliferative, or if they have had surgery or laser 3 months prior to this. And we followed them every month if they needed injections, and if it was only checkups, they were seen every 2 months. So this is the algorithm we used. The patient, as standard, get 3 injection Lucentis, and when we got here at month 4, we looked at the anatomical result, and if we have had a reduction of the macular thickness of more than 10%, 1 more injection was given. And here we also had the opportunity to do complementary laser treatment. And then we continued to follow the patients, and when they were dry, they were seen every 2 months. And if they needed a new injection, we retreated with 1 injection, not like in the Lucentis label or in the studies where they suggest that you shall give 2 injections if you have a recurrency. So our results then. We followed 112 patients for 2 years, and a few of them, 16 patients, were only partially responding to this treatment, and they were offered to switch to another treatment. So they got dexamethasone, Osidex, instead. And for this study, we used their latest visual acuity value before they entered the new therapy. That is, as you know, it's called latest observation carried forward. Some baseline characteristics. The majority, almost 90%, were type 2 diabetes. And here you can also see that type 1 diabetes, they were definitely younger, around 40 years, while type 2 were almost 70 years mean age. And that is quite similar to the RESTORE study. And there were more male than female in this study, and that's also similar to other studies. A little bit more common with diabetic maculopathy in men than in women. So here we have the visual acuity. During the first 3 months when they got their first injections, we have an improvement of about 6 letters, and then that could be continued all over here to 24 months. And that's comparable, if you see here the 2-year data, and it's definitely within the same range as the clinical study. And if we divide this into type 1 and to type 2, you see that there are not so many, but type 1 diabetes, they did even better, or a gain of letters from 10 to almost 12 letters at 2 years. And we think this has to do with that this group are definitely younger patients, and we all know that when you treat different macular diseases, younger patients tend to do better. And we had almost 60% that gained more than 1 line, and 44% that gained more than 2 lines. Looking at macular thickness, as expected, we had this reduction quickly during the first injection, also similar to the RESTORE study, and it was sustained throughout 2 years. How about laser treatment? Well, to start with, more than 70% of our patients have had laser before they started with the injection therapy. And during the study, 30% got more laser. And I think we now see that we are doing less and less laser actually. And in this study, it was only 15% that did not get any laser. During the first year, as you can see here, there was a mean of 4.5 injections. So that was 2 injections less than in the RESTORE study. And during year 2, it was actually only 1.3 injection given. And as you see here, 40% did not need an injection at all during year 2. And what about these non-responders, these 16 patients that did not respond good enough to Lucentis? They were offered treatment with Ozurdex. These patients, when you look into their charts, they have, to start with, they had lower visual acuity compared to the responder group, and also they had definitely thicker maculas to start with. And if you see on the reduction, they start here with a thicker macula, but slowly they also you can see the reduction in thickness, even though it is not as fast as for Lucentis. Here they get Lucentis, and here we start to give them Ozurdex injections instead. But over here, they are actually the same thickness as this responder group. And then you wonder, of course, do they do as well in visual acuity? And actually they did. At 2 years, they gained 6.1 letters compared to the responder group with Lucentis with 6.2 letters. So in conclusion, Lucentis injection improved vision rapidly and sustainably, and a loading phase of 3 injections followed by PRN, that is, as you know, treat as needed, based on OCT and visual acuity, provided good visual outcome up to 2 years. And almost half of the patients gained at least 2 lines. And 5 injections of Lucentis were needed during year 1, and only 1 injection during year 2 to sustain a good visual outcome. A few patients, 15%, were only partially responding, and we found out that Ozurdex could be a good complementary therapy for those patients. In this study, we cannot say so much about the role of laser. However, as you saw, the majority of our patients were already laser treated, and 30% got laser during the study. And patients with type 1 do better, and we think probably that has to do with that they are younger patients. So, muchas gracias from Stockholm.